Within the past 5 years or so, the American Academy of Pediatrics has made some new recommendations about supplements that they recommend for breastfeeding infants. And it's very common for mothers to wonder why we need to give these supplements, because breast milk is obviously the best food for a growing newborn. And the feeling would be that, well, it should come with everything an infant needs. So the most common and the most recent recommendations have been to supplement infants, first of all, with vitamin D if they are solely breastfed or partially breastfed. In order to not need this recommendation or not need this vitamin D, we actually feel that children need a full 30 ounces a day of formula that is supplemented with vitamin D. And so why do breastfed infants need vitamin D? Why can't they get it from breast milk or from the other place that we get vitamin D, which is from the sun? Well, breast milk, unfortunately, is not very replete with vitamin D. Every liter of breast milk only has between 30 and 80 units of vitamin D per liter. And infants, it's recommended, get at least 400 units a day. And I have yet to meet a newborn baby who drinks 4 liters of breast milk a day. So if you could guarantee that your baby's getting 4 liters of breast milk a day, they probably would not need vitamin D supplements, but that's very impossible. The second thing that parents will ask me is, well, what if I, as mom, take vitamin supplements? And certainly that can increase the amount of vitamin D in your breast milk, but again, only gets it to a maximum of about 80 units per liter, so not enough to really make sure infants are getting enough. The other place that we get vitamin D from is the sun. And so a lot of parents will ask me, well, can't I just have my baby have sun exposure? And yes, that would be an option. Unfortunately, to get enough vitamin D, you have to be outside because glass blocks UV rays. So having indoor sun exposure is not adequate. And you cannot have any sunscreen on. So it has to be full body exposure twice a week for 30 minutes with no sunblock. And obviously, we don't recommend that children get direct sunlight for 30 minutes with no sunblock and no clothing on, because that puts them at increased risk for skin cancer. And that obviously, through a lifetime of accumulation, would not be a good thing. Vitamin D supplementation, in addition, being replete with vitamin D, has been shown to have all kinds of benefits, such as improved immune regulation, helps prevent breast and prostate cancer later in life, has been shown to be associated with lower rates of autoimmune diseases, type 1 diabetes and celiac disease, as well as lower rates of allergic diseases and asthma. So it has all kinds of benefits in addition to being a necessary vitamin. When people are low on vitamin D, the disease that occurs in children is called rickets, and that basically is soft bone disease. It's very important to have enough vitamin D, helps regulate your calcium levels, and helps maintain the normal structure of bone. Children who don't have enough vitamin D will develop thickening or widening of the bones at the wrists, and softness of the skull, and again, of course, those are things that we want to avoid. So we now recommend that all children who are not exclusively breastfed receive 400 units of vitamin D supplementation a day. And you can buy that at a number of places. Almost every pharmacy will have either vitamin D available with 2 other vitamins, vitamin A and vitamin E, in a Tri-Visol solution. Or you can find sometimes just vitamin D by itself, and you can give that as well. That's why we recommend vitamin D supplementation nowadays. What we did find was that when we were not giving vitamin D, that the rates of rickets actually increased very significantly. And then almost all the children that we've seen in America and Canada, when we've done studies who had rickets, were exclusively breastfed children who are not receiving vitamin D supplementation. The other newer recommendation within the past year has been that for infants who are exclusively breastfeeding, who will not be starting on iron-fortified cereals by 4 months, that those infants are given a low-dose iron supplementation. And the reason for that is that during pregnancy, infants start to store iron that they can use after birth because breast milk has very little iron in it. The iron that is in breast milk is very bioavailable, meaning your body gets a lot of use out of what it gets, but it's just not getting large amounts. And so after birth, infants get some iron from breast milk, but not enough to sustain their stores. They basically start using what they've built up during pregnancy through the first few months of life. And most of the time, they will have run through those stores by between 4 to 6 months of age. So infants who start iron-fortified cereals at 4 months don't need any iron outside of that fortified cereal, but many moms nowadays don't want to start any foods until infants are 6 months. They want to exclusively breastfeed for 6 months, and that's great. What we recommend nowadays for those children is that mothers give a low dose, 1 milligram per kilogram of body weight, of iron supplementation 1 time a day so that children do not run through their iron stores. The risk when children run through their iron stores is anemia. So iron is the mineral that we use to maintain a normal red blood cell count. It's your red blood cell count that we look for when we're determining whether you have anemia or not. And when your body uses up all its iron, it can no longer produce red blood cells at the rate that it needs and will eventually become anemic. Mothers can definitely take iron supplementation. Again, this may increase the amount of iron in your breast milk, but not to a level that would be adequate to sustain the child's needs to make red blood cells at the level that they need to make them. So those are the 2 supplements we recommend nowadays, vitamin D and iron, and that's why we recommend them.